residents have reported seeing a large funnel cloud moving southeast at a rapid rate. All residents who live east of County Line and west of the Pine River are urged to take cover in a basement or tornado shelter. Let's go out to West.
Emergency response teams arriving from Magnolia. Tornado incident. Mass casualties arriving. Prepare for disaster triage now. Go! First patient arriving on scene.
I think I broke my arm.
Yes? Okay. Are you in any pain right now?
Yeah, it hurts really bad. Like 10 out of 10.
10 out of 10 pain, but your respirations are at 20 right now. I have a heart rate of 90. Good capillary refill. We are going to set you over here in our minor injury zone, and we will see you as soon as we can. Somebody will be by to check on you.
Thank you.
Ma'am, are you okay?
No,
What's the matter?
my arm. Something's wrong with my arm.
Yeah, you're bleeding pretty badly here. You having any trouble breathing?
No, my arm.
Okay, I just need you to calm down. Your respirations are really stable. You're at 22 breaths a minute, and we have a heart rate right now of 60. Okay, we're going to keep some pressure here on your arm, and we'll see you as soon as we can. But you are in the intermediate yellow tagging right now.
Oh!
Nurse, I saw her thrown out of her car. She was thrown out of the vehicle.
Suspected spinal injury. Do not move her. Respirations are at 28, and her heart rate right now is at 60. We're gonna put you. Our last patient will be tagged red to be seen immediately. Urgent care. Get her a collar. We have to stabilize her spine.
Nurse, she's got a tree line stuck in her. She can't breathe.
Respiration. She's having severe dyspnea. We're at 40 respirations a minute. Tree limb impaling her right lung right now. We're going to need a chest tube here stat. We're going to label her with a green. Be seen immediately by the doctor. Let's get her on the stretcher, folks. Our last patient will be tagged red to be seen immediately. Urgent care. Ma'am, are you okay? She is not breathing. She has no pulse. We'll have to label her black.
down how we do the disaster triage. So disaster triage, the main thing with that is that we have limited resources and limited staff. So we really have to prioritize based on those guidelines. And in the skit, we kind of gave you an example of each patient. And you saw Nora, she was doing a few basic things. Initially, she checked to see their respirations and their pulse, so circulation. If a patient falls into the black color-coded triage, that means that they have either died or it's expected that they will die. So there's not any chance of survival. Essentially, our resources have to be directed elsewhere. Red means that they need to be seen immediately, like a stoplight. So stop and see this patient first. Their injury is life-threatening and they need care immediately. And yellow means that they could soon become red, but we have a little bit of time there. So their care is delayed, so you slow down, see them second. They have significant injuries, but they're not critical injuries. And green means that they have minor injuries. So essentially they're walking, talking. They could even potentially treat their own injuries. So minor things that aren't life-threatening. And there's a simple method of triage. It's called the START method. And it helps to determine what tag color a wounded victim should receive. And START stands for Simple, Triage, and Rapid Treatment. It's used for an adult, and it's very easy to use and quick. So the first thing that you want to do is you want to look at the wounded individual and ask yourself, what is the wounded victim doing? Are they able to walk? If they are not able to walk, then they are either going to be a yellow, red, or black. Only the green patients are able to walk. And then if the wounded individual can walk around and move, their breathing, circulation, and their mental status are within normal range, they're tagged green. If they're unable to walk or move, then you would move on to these other assessments. You check 3 things in order: breathing, circulation, and mental status or neurostatus. The wounded individual that cannot walk will either be red, yellow, or black. If they're breathing and their rate is greater than 30, they have a red tag. If they're breathing and their rate is less than 30, then you check their circulation. If they are not breathing, then you reposition their airway. And if they're still not breathing, then you do a black tag. If they are breathing, then they will receive a red tag because they're only breathing because you reposition them. They need immediate care. Then you check their circulation. You use their radial pulse. And if it is present or less than 2 seconds, and with less than 2 seconds capillary refill, then you would check their mental status. And if there is no pulse, then they're automatically red. Then once you check their mental status, that determines whether they're going to be yellow or red. So if they're able to follow simple commands, they will be yellow. If not, then you would suspect some kind of neuro injury, they would become red.
Okay, so we have emergency and disaster preparedness in nursing. And it is Emily Coffey, Emily Conrath, me, and Nora. So we have an emergency is an event that requires rapid and skilled response with resources that we already have. So that would be like a trauma, anaphylactic shock, chest pain, or burns. And then a mass casualty is a natural or man-made incident that overwhelms resources that we already have available. So this is something that we would need to get assistance from outside resources. Normally, this would be something that you may get Red Cross involved with, or any kind of outside agency or additional resources. This can be a natural disaster, active shooter, bioterrorism. So this is a cycle developed by the International Council of Nurses, and it's basically the framework of kind of okay, so this is used to help prepare for and this is used to prepare for and prevent disasters. It includes training, response, um, incident stability, property preservation, evacuation, recovery, includes debris management, housing, health and social services, and then mitigation includes public education, hazard, vulnerability assessment, improved infrastructure. This is a quote that we got from one of our journal excerpts, and it says, knowing in advance exactly what's expected of the organization during an emergency or disaster gives the staff the opportunity to acquire the pertinent knowledge and to practice necessary skills beforehand. And this is a list of the common organizations that may have to help during a disaster. This is about risk reduction in emergency nursing. Disaster preparedness training of all healthcare professionals is essential to maintain an efficient healthcare system in the midst of a disaster, particularly in view of potentially widespread nature and complex environment of this type of incident. So recently, the World Health Organization has been recommending that healthcare professionals all get trained for disasters, and nurses must be involved in all phases of disaster planning in order to increase their understanding of the role and expected contributions in response to disaster. And the link to that is over here.
Okay, next we're going to talk about what's my role in an emergency. Nurses are essential in the workforce during disasters as they make up the majority of healthcare providers. In disaster management, nurses work with other healthcare providers to identify and plan for risk, participate in preparedness, education, and training, respond efficiently and effectively in a timely manner, and participate in the recovery process with other disaster management teams. These are the qualities of a nurse in a disaster. Nurses must have confidence, cooperation, commitment, coordination, control, value of human life, gentleness and devotion, strength, trust, interdependence and team spirit, acceptance of self-criticism, toughness and sensitivity, leadership, responsibility, and accountability. The plan of action in an emergency includes triage according to acuity, do focused primary assessment, including ABCs, neurological status, and focus assessment related to chief complaint. Secondary survey includes a full set of vitals and further assessment to facilitate data for chief complaint. Most critical patient is seen first. The more care and resources a patient needs, the higher ESI level they require. This takes quick and adequate assessment skills. This is just a table for the plan of action in emergency with the 5 levels of the ESI. which has the stability of vital functions rating from unstable, threatened, stable, up to ESI 5 stable, life-threatening or organ threat. Also includes how soon a patient should be seen by physician, also expected resource intensity, and some examples for each level. The ES1 being cardiac arrest, intubated trauma patient, or an overdose with severe respiratory distress. ESI2, chest pain, probably resulting from ischemia, and ESI3, abdominal pain or gynecological disorders. ESI4 could be examples of closed extremity trauma, and ESI5 is also cold symptoms and just major or just minor problems. Next. The plan of action in disasters and mass casualty is we start with discharge stable patients, triage patients within first 15 seconds to 1 minute to identify actual or potential life-threatening injuries, identify resources needed outside agencies, beds, staff, and supplies, assess respirations, pulse, and mental status, and the use of tag system during triage. These are demonstrated as the black for dead or death is imminent. Red is life-threatening injury needing immediate attention. Yellow is urgent but not life-threatening. And green is minor injuries. The expected outcomes are maintaining ABCs, making sure that we document accurate. Patients are triaged within designated time frame, making sure that we keep effective communication, decontamination performed without further injury to patient or staff, and interventions are started immediately following triage dependent on illness or injury. Other expected outcomes: patient will remain free from adverse effects of injury and contamination. Community will participate in mass casualty and disaster readiness drills. And the staff will demonstrate the proper use of PPE, and the community will have resources for emotional support and grief counseling. That about sums it up. Emergency and disaster nursing requires resources, teamwork, and education. Everyone must know their role and practice skills accordingly. It is important to include emergency and disaster curriculum in nursing schools because these events are more prevalent than ever before. Know your facilities, policies, and procedures, and be familiar with what kind of events may occur in your area. Next. And here is a